The House of Representatives Committee on Specialty Healthcare is calling for stronger partnerships to enhance specialized healthcare delivery in Nigeria. The committee held a stakeholders roundtable in Abuja where experts and industry leaders discussed key areas for improvement. The House Committee on Specialty Care, led by its chairman Honorable Alex Egbona, is spearheading efforts to tackle critical challenges in the nation's specialized healthcare system. At the roundtable discussion, lawmakers, medical professionals, and stakeholders gathered to review the proposed legislative activity implementation framework aimed at addressing healthcare gaps. The committee cited several pressing issues facing healthcare providers, such as outdated infrastructure, inadequate medical equipment, unreliable electricity, and poor funding. Honorable Egbona noted that referral hospitals, which handle critical cases, receive the least budgetary allocation.
In the course of this, our legislative duties and committee activity, we discover some cross-cutting challenges faced by the specialty healthcare provider and the institution in Nigeria, like infrastructure decay, lack of prerequisite medical equipment, poor electric power source supply, and poor inadequate funding. The committee sadly note that the specialty hospitals and healthcare centers serving the nation as a referral hospital or specialty health emergency are the lowest funded in the health sector budget. The committee therefore invites you all here today as a professional and expert to review the draft legislative activity implementation framework, make your observation, contribution, intervention, and input on the document.
Stakeholders at the event emphasized the need for better digital healthcare access, increased use of e-health systems, and more awareness around mental health to reduce stigma.
It's very important we are important stakeholders in this, and we are very happy to be part of it. We look forward to a very useful outcome in this discussion, and we hope that, we look forward to having a very improved legislative framework that will guide mental health services and other specialty healthcare across the country and bring a lot of benefit to Nigeria.
Another key discussion point was the regulation of alternative medicine. Experts stressed the importance of setting standards for traditional medicines to prevent abuse and health risks.
That sector of healthcare is one sector that seems to be ignored, and part of what we've been trying to push for is a proper council to regulate the activities of the members of the of TICAM, let it not be, yes, of course, there are some that seem like they can't be regulated in quotes, especially the traditional people that inherit one thing or the other from their grandfather, great-grandfather, and all that. But you see, the way the world is moving now, there's need to put some regulations, especially like where a traditionalist is telling you go and pluck some leaves, what quantity, who is directing who. Of course, there's been a lot of abuse in that sector.
The church will carry out the mandate of looking after people like this. Currently, we have up to 100 people with disability that, as a church, we are paying for their health insurance. This gathering and meeting with stakeholders will further encourage us to do more.
To push these initiatives forward, the committee has given stakeholders 10 days to review the legislative framework and submit their recommendations. The hope is that these efforts will lead to a more inclusive, efficient, and well-funded specialized healthcare system. Annie T. Patrick, Core TV News, Abuja.